Say hi.
Hi.
Hi, guys.
Hi.
So this is my son, Justice, and many of you have asked, can he sit? Can he walk? And what his diagnosis is. So he was born at 28 weeks, weighing only 2 pounds, 15 ounces. And he also had bleeding in his brain, and he has brain damage from that. I explained it in another video. I'll try to link that below after we have seen neurology. But the ventricles in his brain are larger than like you and I will have, and there's white matter around it, and that's where his brain damage is. The rest of his brain looks normal and is functioning normal. That's where his diagnosis with CP comes in, and he also has high muscle tone. So he's always flexing. I don't know if he's gonna do it now. Probably not. But he's always flexing, and he's always burning insane amounts of calories. So we're always on top of how much he eats, trying to get good fats in him. Like we try to put coconut oil on almost everything, avocados, the chia seeds adds extra protein. So he's like in a high fat, high protein, high carb diet. Yes, baby. And like I said, cerebral palsy affects all his limbs. When he came to us at 8 months old, his arms were tucked in and fisted, and it took us a long time for him to like stretch out. We've been doing a lot of therapy, occupational therapy, physical therapy, and we've been doing a lot of stretches. He still cannot sit up, but he can sit up for a couple seconds, and then he'll fall over. But we're working on his trunk strength. Also walking, he has a stander, which is in the moving truck, which we really need, but you guys know our situation. Moving days they're not going to come until the 22nd. So, but as soon as we get that back, we're going back to that every day, putting him in there to strengthen his leg muscles, so that way, hopefully in the future, he'll be able to stand and walk. With his high muscle tone, he may require Botox. We did go see neurology about that, and they were willing to do it then, but Dustin and I wanted to do more research on it. But I think we are going to go get Botox on his legs, because we've seen many kids who have done it, and when the next day they're crawling and doing wonderful things. But hopefully he'll catch on to it. Like, he wants to crawl. He's so determined, but he can't. His arms right now he can't put them straight when he wants to like lift up and move them forward. He can't get the coordination to do that. But he's so determined, and his determination is what's driving him to do the things he is able to do. And he is able to say a few words. He'll say mama all the time. He started saying daddy. He used to say gege. Now he says daddy a little bit more clearer. He has said Mackenzie and Alice's name, but he prefers to call them Kinsey or Ali, or just guys. Every time they'll go somewhere together, he'll be like, guys, trying to get their attention. What are you biting on your finger? And he also has tried to say Georgia's name, which is one of our Jack Russell. Sophie, he hasn't really attempted to say her name that much, but I mean, he tries every now and then, and he does regress. There's days where, like, especially if he's teething or something else going on, he'll regress a little bit. There was a time where he was saying mama all the time, and then he started teething, getting 2 teeth in at once, and he completely stopped talking for a month. And that worried me, but PT, all his therapists reassured me that it's going to happen because it's too much going on for him, especially with his brain damage, but that he'll pick it up again when he's ready. And sure enough, he did. And sometimes we have to keep that in mind, that when he's learning something new, he might forget how to do something else for a while, but he'll pick it up again. But he's a happy baby. We have never had any issues with him sleeping. He always sleeps through the night. He does have separation anxiety every now and then, especially when we move. We go through like 2-week transition, trying to get him back into his own room when we travel, or right now, like we moved, it's gonna be when he gets his stuff, he's gonna sleep in his own bed, and we know that's gonna be a pain, but we're gonna give him time to adjust. He's still adjusting to this home because our stuff is not here, so nothing is familiar. And he wears these AFOs too for his legs. It kind of helps with the hypertone, but also to keep his feet from not pointing all the time, because they're always like pointing. So he wears these every day. These are not the best ones. These are more like one size. Oops. So these AFOs are not the best ones, and I wouldn't want to get them again. They're more like a one size fits all. They didn't cast them. They just measure his feet, and I went to the place thinking they were going to cast his feet to get a good measurement of them, but they didn't. These are kind of newish, and they're sending them out for kids who are younger. And PT, his therapist, and I didn't like them. We didn't like the way they're working for him. His feet are still curling, and we don't like that. So as soon as we get him going here with the insurance here and physical therapies and stuff here, we're gonna try to request to get new ones so he can get actually casted to his feet, and that way they'll work better. He also wears glasses because he's nearsighted. He had a surgery back in last November, and I'll put that link down below. He was cross-eyed for a very long time, and it was affecting his vision. He is nearsighted, so he does wear glasses, but not when he's playing around or rolling around, because he does roll, and because they get in his way. But he got the eye correction surgery, so his eyes are straighter. Justice, can you look at Mama? When he's tired, you can see them like kind of go to the sides a little bit, but for the most part they're straight, and compared to what they used to be. I think I have a picture here I can kind of show you. So this is what his eyes used to do. They were cross a lot, even worse than in this picture. But once we got the surgery, it's been amazing, and we see him not need his glasses all the time. When we see him like looking over, like if you wear glasses and you kind of look over them, he kind of does that, but without glasses. We know he needs them because he can't focus on something. But for the most part, he's good. We have seen 3 different eye doctors. The first one had told us he was farsighted, so he gave us glasses for that. The second one was a military doctor, and he has said he didn't need, his prescription wasn't strong enough to require glasses. And the third one we saw, which was the surgeon who did his eye surgery to fix his cross-sightedness, he told us he was nearsighted. Oh, it fell down. He told us he was nearsighted, and he will require some glasses, but we don't have to have them on all the time. But we do use them when he's in his stander, or when he's watching TV, or doing an activity. But if he's on the ground, like rolling around, we don't put them on him because they get in his way, because he like army cross, and like don't eat that, baby, and rolls around to get to where he's going. And to help open up his hands and arms, we use these arm braces or hand braces. And we just got these before we moved. This one's longer than the one that he used to have before. The one that he used to have, they were tiny, but he outgrew those, and now he has these. And there's also a band that attaches to these, so it can turn out his arm this way, because I can see it. He has it turned in and fisted, and we don't want that. And his CP does affect his right side more. So, but he's opening his hand. As you can see, he's using both hands to hold this, and he has been learning a lot. He picks on stuff fairly quickly, and he surprises me every day. He surprises the therapist too, and I'm just so proud of him. He always works so hard, and he's very determined. He has all of them together now. He likes to play with these. They're not supposed to be played with, but he likes to play with them. We have high hopes for his speech because he's already saying some words, and he's been working with he was working with a speech therapist, but she focused only on feeding, which is great because when he was younger, he would choke on stuff all the time, like even purees, and now he's able to eat like normal, like a normal toddler, and he even eats double what a toddler eats, but he eats very well. He likes all foods. So as for his future, we don't know if he'll be able to stand or walk, but we're working towards that now. And it may not be a year from now, it may not be 3 years from now, but one day we know that he will. Yes, baby. You're so cute. But we're working towards that goal, and I'm in an incredible CP support page, and I see a lot of kids reaching milestones, whether it's young age or older, and it gives me a lot of high hopes. And there's a lot of people out there with CP that are still able to live a normal life, and that's what we hope for him. Yes, baby. So right now we're going to open a box that my friend Lisa has sent him. He has been obsessed with Moana. I already know what is in there because she told me. Justin has been obsessed with Moana. He has never really liked cartoons until Moana came out, and then he started liking cartoons. His favorite show is actually Seventh Heaven, which is so weird, but he loves that show, and he'll watch it for hours if we let him. But the only other show he watches is, or like kind of movie he watches is Moana, and that's the only one that he's obsessed with. We tried other movies to kind of switch it up for us because you know, watching a movie on repeat is not so fun. But it's the only one he likes. Any other one he doesn't like. What you got here, Papa? You want to open it? Yeah? Look it. It's Hey Hey. Can you say hey hey? You say hey hey? Hey hey? Hey hey.